It was cold this morning, too. We had temperatures. It was the coldest in our viewing area seen all season, with lows reaching 0 in some places. Emergency department nurse practitioner Dan Holbrook says most cold weather injuries he's seen in the emergency room are frostbite.
Exhaustion, but frostbite, cold injuries, the colder it gets, obviously the less time you can spend outside with exposed skin. A lot of times there's heart issues, out trying to shovel snow, doing things they shouldn't be doing. The cold weather makes you get dehydrated faster.
Dan Holbrook is a nurse practitioner in the emergency rooms at St. Elizabeth and Home Hospital. He says so far this winter he hasn't had any patients in the emergency room with problems from cold weather. But with temperatures falling, Holbrook wants people to remember to bundle up. He also says dehydration is a side effect most people may not realize can happen in cold weather.
You have to keep yourself as hydrated in the cold weather as well as the hot weather, because every time you're breathing out, you're expelling more and more moisture from your body, and you're all bundled up, so it starts going to sweat into your clothes as well as you're breathing out, and that can be a big problem.
Holbrook says exposing your fingers to the cold weather can cause frostbite, and if you have frostbite, you should go to the emergency room.
Cold sensation, loss to the fingers just feel like stubs on the tip of your hands. Tingling, hot, prickly sensation is usually one of the first signs of once you're starting to get circulation back, if there's any injury to the fingers. Ashen appearance, they feel cold, but if your fingers are already cold, you're not going to be able to feel if they are cold. But key thing is, if you have any concern at all, that's what we're here for.
Wearing layers and putting on your hat, gloves, and scarf could help you from getting frostbite and keep you from visiting here, the emergency room.
The colder it gets, don't expose the skin to the air, because the skin protects the body, but it can only protect so much. Having a scarf over the mouth as it gets colder, that helps to keep moisture in, helps you breathe in warmer air, which doesn't cause any issues with the lungs in terms of cold air drying out the lungs and causing more problems there. But lots of fluids, stay warm, and try and stay inside as much as possible.
Holbrook says wearing layers are helpful, especially with snow. He says as the outside layer gets covered in snow, you can take it off so the wetness doesn't penetrate your skin, which will help prevent frostbite.